Well, let's take you back to one of our top stories. The Health Department is today hosting a World No Tobacco Day session in Midrand, and it's part of, the global fight against tobacco use and its devastating impact on people's health. The Deputy Health Minister, that's Dr. Joe Phaahla, is now giving the keynote address at that event. Let's listen in.
Does not require what they were demanding, that this bill must be discussed at NETLEC clause by clause. There's no such a provision in the NETLEC Act, but we said that to, we know South Africans are very litigious, and sometimes our courts are also not very helpful, even when you deal with public, issues which are for the good of the public. So we had to make sure that we close all those loopholes. So thanks to Ms. Hunter and the, slogging it out there for weeks and weeks. I know it was not a very nice, thing to go through that, but very much it's done. The report has now been presented to the committee. So in terms of any risk of a legal loophole going, we have closed that loophole. So just to remind you in terms of what that bill caters for, as Shinas has already asked us to do, plain packaging is covered within that bill. So we want to make sure that we can introduce plain packaging, follow on the countries which have already taken the step. I'm happy that also on the African continent we can learn from some of the countries. You mentioned Mauritius, Cote d'Ivoire, I heard you saying so. So we're in good company, we're getting there. We also want to strengthen the prevention of advertising. Already the loophole there is there's still, even though in terms of media advertising, that the ban on formal media advertising is already there, but there are also forms of advertising, as you have seen, the new products which are not covered. So we want to strengthen that to protect children in this aggressive marketing. We also want to expand smoke-free public areas. The definition currently, just to give you an example, amongst others, we know that currently in public places, like even restaurants, they are allowed to demarcate a certain percentage of space as a smoking area. So in terms of this new bill, we will be, once it is passed, we'll be able to do away with that. And essentially there will be very few, if any, public spaces which will be, permitted to have smoking areas, especially indoor public spaces. But we're also touching also on outdoor as well. Regulate the sale and distribution of these emerging products, because currently they are not covered. All these e-cigarettes and what do you call them? Huggly, bubbly, all those things. We want to make sure that all those can also be properly regulated, because currently, they are everywhere. So we want to also that bill enhance cessation support to help current users quit and improve their health. Of course, throughout the public hearings, the industry has been spending huge amounts of money, sponsoring people to go to the public hearings. Quite embarrassingly, sometimes I know in some of those areas, even members of my own organization, party, who we are leading in terms of this bill, having been the party responsible in government. But in some public hearings, we had reports that even the members of our own organization were sponsored, and some of them even holding leadership positions were actually sponsored. And they went and promoted and spoke against the bill which comes from, sponsored by their own party and organization. And that's how powerful this industry can be. They've also had their own special, people who are, some of them medical practitioners, who have been sponsored to do this, to promote these products as a form of harm reduction, and that our bill is ignoring the fact that these products are part of a package of harm reduction. But we already know that indeed, that is not the case. So we appreciate also the work of our various civil society organizations, our partners, the researchers, those who have helped us especially during this parliamentary process. We want to assure you that we value your contribution, and we're quite confident that this bill will pass ultimately in Parliament, despite the efforts of the industry to mobilize. Even there are very passionate members of Parliament who are, at every turn try to find a loophole to try and take us back. But we've got a very strong team also there, led by the chairperson of the committee, our former colleague in the previous administration as the deputy minister, now chair of the committee, Dr. Jomo, who's really leading from the front with the team there. So we're quite confident that we will succeed. But we also want to thank again the members of the media, because we believe that we have a very important role, and that's why this event this morning, because we believe that through you, people can get the proper information, so that they can be, if they get accurate and scientific-based information, they will be able to make informed decisions. So we really appreciate the media presence here. We must all remember that every life lost through tobacco is indeed preventable. We don't need in our bodies. Nicotine doesn't add any value. Addiction fuels a cycle of harm that we must be prepared, we must actually be committed to break. Protect the well-being of all South Africans. So indeed saying that, from the government side, we'll make every effort, legislative, regulatory, but also in terms of mobilizing society. But of course, we can only succeed working with yourselves as NGOs, the civil society, members of the community, especially the young people. And thank you very much for the very creative dance. We need more and more of that as more methods of communication. So thank you very much. Again, my apology that I'm not going to be able to stay for the rest, but I'll stay a little bit longer so that, if there are any comments, questions which one may need to deal with the program director, I'll stay a little bit, but again, my apology that I will not be here until the end. But thank you very much, and I'm sure we're going to win, we're going to conquer, we'll be able to defeat tobacco.
Thank you very much, DM, for the message of commitment.
All right, once again, these are live visuals you're watching from Midrand, the health department holding a World No Tobacco Day session. The day itself is actually marked on the 31st of May, which was yesterday, but this discussion is taking place this Monday morning, and really the objective here is having discussions around ways in which the country's laws could be adjusted in order to promote people's health, at least insofar as smoking is concerned. And this is all encapsulated in the Tobacco Products and Electronic Delivery Systems Control Bill, which is set to replace laws dating back to 1993. And essentially the key provisions of this piece of legislation is introducing 100% smoke-free areas, which would prohibit all indoor public spaces and certain outdoor areas as being places where people can smoke. It's also got a key provision around plain packaging, banning on point of sale displays, banning vending machine sales, and also regulating e-cigarettes and vapes. And that's really the sentiment that's been reflected by the health minister, who's also said that nicotine doesn't add any value. You can imagine, of course, it's a process that has a fair amount of pushback given just the money, frankly, that's concerned or that might be affected here. People in the industry itself pushing back quite strongly, citing possible economic fallout from that bill if in fact were to be passed. We'll continue listening into all of that. It's a very heated debate, of course, and you and I know at a personal level someone who smokes would very much want the status quo to prevail.